My name is Esther Kabaswaga and I'm a PGY1. I have quite a number of memories from medical school, but the fondest is when we were done with medical school and we had this outing. We went to the national park, but it was the joy of being done with medical school. I chose my profession because it's very satisfying on very many levels. One is because you're interacting with people who are in their time of need, but I also like how challenging it is having to form deep diagnoses, but overall it's forming meaningful relationships with patients and having them be part of their medical management. So very many aspects make it very interesting for me. My first job was working as a kindergarten teacher way back home. I think I was about maybe 15, 16. So it was really nice working with kids. I still enjoy interacting with kids, so it was a very interesting first job. Thank you.
You're welcome.
It depends on the time of the day. So I have two drinks. I have matcha tea with coconut and I'll have a cappuccino in the morning. My favorite holiday is Christmas, and I love Christmas because that's the time we gather as a family. You get to see family members you've not seen in a very long time, but I like how festive it is. I like exchanging gifts, and everything around Christmas is really exciting. The best life advice I've ever received is to never stop learning. And I like that this is not just applicable to my work, but to every aspect of life. So there's always something new that you can learn, and there are several ways you can learn. So you can read, you can do research, you can interact and learn about new things. There's just always something new to learn. The people you interact with, they will know things that you don't know about, and I think that's like very, very good advice everyone should receive. My guilty pleasure is chocolate. It's not as healthy, so I try to moderate that, but yeah, so I love chocolate. I've had quite a number of memorable patient experiences, but this particular one is recent, but also it's because it had to do with a terminal diagnosis for one of my patients that I was seeing. As always, good news is very distressing to the family. So this particular family was going through a terminal diagnosis for the mother. And I remember sitting down with her daughter after she received the news. We stepped aside and sat, she talked and cried, and I sat there listening and let her know that we were available to help. Later on, she communicated back to me and told other colleagues that my sitting with her and listening and letting her express herself was very important in her dealing with the news of her mother being terminally ill. So it's moments like that that motivate me to do my work, because I know we do everything else, like the treatment, the actual treating the patient, but that's not all it. We need to help patients deal with their diagnosis, and it's that extra care that the patients never forget. So that's very memorable for me because I know I made a difference in this family's life.